The Vanguard programme is one of the initiatives put through by the government. It's a programme whereby we can integrate closer primary care in terms of general practice, community care, social care and other health partners. For example, in this area, the out-of-hours service and mental health service as well. Get these areas all working much closer together, all singing much more from the same hymn sheet to deliver connected care for the patients, with the effort to try and keep patients more at home or in the environment they want to be, as opposed to unnecessarily being in a hospital environment. Because at the end of the day, it's the clinicians on the ground, the GPs, the district nurses, etc., who are delivering that care. And we've worked very hard to increase the communication between them. So be that just verbal in meetings, or be that via the shared record and the computer systems that we have in terms of tasks and instant messaging. And also we've integrated now what we call community delivery team meetings. So all the practices will have regular meetings, sometimes weekly, sometimes fortnightly, between the community staff, the general practice staff, and crucially what we call the care coordinator, who is somebody who sits within the practice, so in the same building as the GPs, who acts as a fulcrum between these two services.
That sounds great. And I'm thinking if we do a joint visit.
We tend to now be able to identify patients who haven't necessarily had a previous admission, but we think might be at risk in the future because the team's working together. And I think the real advantage is because we're meeting face to face, we're building really good interprofessional relationships. So it's much easier to get in touch with people and discuss patients that we're concerned about and put help in place much quicker because we've got those good working relationships developing.
Well, the doctor comes very often. If I'm not well, I phone up and the doctor will come. Or sometimes Matron Pat, I call her Matron Pat. She's a lovely lady. She's a matron, obviously. And then I have district nurses, about 4, and they pop in because my legs get swollen and I've got an ulcer on my toe. And they come in to change my dressings. And also I have people like social workers and things like that. They all have a file with my record on and computers, all on a computer. They bring their laptops with them and they can tell me things I need to know. If I've been to hospital for a test, haven't got the results, they can type it into their laptop and tell me what the results were. So it's very good. And I'm diabetic, and with one hand, I've only got the use of one hand. I find it very difficult to do my blood monitoring, so they will do that for me. They're very, very helpful and very kind.
Hi there, it's Hannah, the care coordinator from Old Station Surgery. Hi, I'm just calling to see how you're doing now that you're home from hospital. Oh, lovely.
The Welcome Home service has been up and running here in Erewash for just over 2.5 years now, and it is very much as it sounds. It's a service where people who have just come out of hospital get contacted by our care coordinators to find out how they're managing once they've got back home and to check that there's nothing else that they need to help them manage stay back at home. So they will ask questions like, are you managing with your medication? Do you have some food and drink in the house? Have you got your care coming in that you need? Are you managing to get around the house okay? Because these are all things that people can struggle with once they're back home. Nobody wants to be in hospital, but even more so people don't want to go back into hospital. And the service has been really successful in preventing that from happening and giving people the option of staying at home for as long as they possibly can.